Hello, I'm Dr. Adil Riaz, consultant radiologist at GIT Medical and Diagnostic Center. Today we are here with another episode of our ultrasound training course. This episode I'm going to upload after a brief gap, just because some professional engagements and a little bit overload of the patients, I was not able to make any video during the last month. And so in this episode, we are going to cover relatively difficult organ to be visualized on abdominal ultrasound, and that organ is pancreas. So I personally consider that pancreas is the one of the toughest organ to be visualized on the abdominal ultrasound, because the abdominal gases and the gut and the stomach, they are obscuring most of the time the pancreas. For this purpose, I give you a tip. If you start visualizing the pancreas and it is not visible, I will recommend that you ask the patient to drink 1 or 2 glasses of water, because it will fill the stomach, and then we can use the this fluid filled window to visualize the pancreas, just like we use the urinary bladder to visualize the uterus. So starting now, I will be using my curved array probe for the purpose. I will apply the gel in the usual manner. Now I will put my probe vertically in the epigastric region. Here I have put my probe. Here you can see a lot of abdominal gases which are obscuring the midline, and this is the stomach. And as my patient has taken 1 glass of water, this is the fluid filled stomach. Now, keeping my probe steady in the midline, I will apply a little bit pressure and will try to dislodge these abdominal gases. This is aorta, which is pulsating, and in front of the aorta, here is the pancreas, which is soon going to come into our view. Yeah, this. Here is the splenic vessel, which is crossing the pancreas, which is lying in between the pancreas and aorta. And pancreas will appear as an isoechoic coma-shaped structure. It will be extending from here to here. On the right side, there will be the head of the pancreas. In the midline is the body of the pancreas, and on the left is the tail of the pancreas. So, as I have told you that it is a difficult organ to be visualized, it will definitely take some time. And it can vary from patient to patient. If the patient is thin, lean, the pancreas will be visible relatively easily. If a person is of a little bit overweight, it will be very difficult to visualize the pancreas. Now, here we can see the head of the pancreas. This is the head of the pancreas. And now it will continue as body. Here, this thin structure is the body of the pancreas, and I am continuously applying pressure. If I will redraw my hand, I will release the pressure. This will be obscured by bowel gases. I will again apply the pressure, and again this is the body of the pancreas visible, and it is leading to the tail of the pancreas. This portion, this is the tail of the pancreas. I am right now not in this view. We are getting almost complete pancreas in a single view. This is head, here it is body, which is a little bit thinned out, and this is the tail of the pancreas, and this is aorta, which is continuously pulsating. So applying the to visualize the pancreas, one of the most important things is to apply adequate pressure, and the adequate pressure will be a little bit more than that of the normal pressure we will be applying for visualizing spleen, kidneys, liver, etc. Here again I am showing it is the head of the pancreas, this is the body, and it is the tail. It will require again and again doing practice, and I'm telling you that it will be the most difficult organ to be visualized on abdominal ultrasound. But there are some tricks. Number one, keep your hand steady, apply adequate pressure, and if on applying pressure the gases are not displacing, then give intermittent pressure. Apply the pressure, release it. Apply the pressure again and release it. And we have to keep it in mind that applying the pressure should not be giving pain to the patient. It should not be tender. So we have to give the adequate pressure. Secondly, I will recommend that we do this pancreatic scan when the patient has taken some fluid. It is necessary. However, most of the time in the cases of chronic pancreatitis and acute pancreatitis, patient is NPO. So in those cases, it becomes difficult to visualize the pancreas. Now, what conditions we are supposed to see in the pancreas? The pancreas is a homogeneous structure. If it is heterogeneous in texture or it is having a fluid around it, it means that the patient is suffering from some disease, likely acute pancreatitis. And if the pancreas measurement is 2 into 2 into 2 centimeter, means head is 2 centimeter wide, body is 2 centimeter in depth, and tail is also of 2 centimeter. If the size is less than that of 2 centimeter, think about a chronic etiology. And if the size is more than that of 2 centimeter, then think about an acute etiology. We have to look for any mass within the pancreas, and we also have to look if there is any pseudopancreatic cyst or pancreatic pseudocyst. Pancreatic pseudocyst is the collection which gathers around the pancreas when there is acute inflammation. Most of the time, it resolves spontaneously, and it will appear as cyst-like structure anterior to the pancreas. It could be anterior to the head of the pancreas, body of the pancreas, or tail of the pancreas, or covering all of the pancreas on the whole. Pancreas is the retroperitoneal structure. That's why it's a bit difficult to visualize it. Anyhow, continuous practice could make you quite able to visualize the pancreas. And from time to time, it is possible that in some patients you might not be able to visualize the pancreas despite all your efforts. So, especially when the patient is overweight, it will become very difficult. Now, coming to the evaluation of intestine. To evaluate the intestine, I have to use my high frequency linear array probe. I will apply the gel, will change the probe, and now I will put my linear probe in the coming to the evaluation of intestine. To evaluate the intestine, I have to use my high frequency linear array probe. I will apply the gel, will change the probe, and now I will put my linear probe in the again in the mid epigastric region, and then I will start it moving downward. Here you can see this is the gut in which contents are moving. These are the moving gut loops. Here you can clearly see the movement of gut contents. Now I will move in a in direction of the right iliac fossa. I will move from epigastric region to the right iliac fossa, and I will keep on evaluating the gut loops in my path. And here the gut is visible with having its motion. In this region, now especially in the region of right iliac fossa, I will look for any inflamed bowel. Appendix. Appendix will appear a blind-ended structure of gut, and it will be non-peristaltic. Now look at this structure. It looks like the appendix will appear just like this, but it will be non-peristaltic, while this segment of bowel is showing peristalsis, so this is not appendix, and it will be blind-ended, but this segment of bowel is not blind-ended. It is communicating with other bowel loops. So it is not appendix, but the appearance will be same. So I will evaluate the whole abdominal cavity with my linear array probe, and I will see if there is any lymphadenopathy or any abnormal bowel dilatation, or any abnormal bowel wall thickening. The normal bowel wall thickness is up to 3 mm. Here you can see it is 1.8 mm. So it should not be more than 3 mm in any case. These are gas filled bowel loops which are showing normal peristaltic activity. So for the evaluation of the bowel, I will see bowel wall thickness, bowel motility, and I will see if there are any linear structures within the bowel lumen, which could be due to the Ascaris lumbricoides. And then I will see for the mesenteric lymphadenopathy if there are any enlarged lymph nodes, and I will look for inflamed appendix in the right iliac fossa. These are the main things which I will focus in evaluation of the bowel, and then if I find anything, then accordingly I will proceed my study in that direction. Now with this we came to the end of our episode. In the next episode I am going to cover full abdominal ultrasound in 5 minutes, how we are going to perform a fast scan in 5 minutes, and then from next episode after that we will be moving toward the gynecological ultrasound. I will be waiting for your feedback. Your comments and are very valuable to me. You please do like, share and comment on my videos. Thank you so much. Allah Hafiz.